welcome back. I'm here today with Joe DeLuca. He is the founder of IT Optimizers. Joe, welcome to today's show.
Thank you, Alan. Pleasure to be here.
So, Joe, can you give us the background? How did you get where you are today and the experiences you had along the way?
Sure. Well, first at IT Optimizers, we are a healthcare-specific informatics and information technology consulting firm. And it's really at the sort of pinnacle of my career. I started back, I won't date myself completely, but started back in the college days where I was a scientist doing early stage DNA research and looking towards a possibility of a MD or PhD type career, and decided instead to aggressively move into healthcare program management, where I started to use informatics, data processing, if you will, data analytics, to improve the quality and efficiency and effectiveness of our healthcare system. I was fortunate enough to work in some early leading projects that gave me the taste, allowed me to see some of the success associated with that, and that's continued on through a career in consulting at the high end of healthcare informatics.
This has been a big part of healthcare advancements in recent years. With, I believe one of the early pioneers, correct me if I'm wrong, but Affymetrix, were they early in this stage, and then for health DNA mapping?
They were. So they were an early firm that developed microfluidic technologies, which allowed for the rapid and decreasingly expensive DNA analysis. It was very expensive at first and required large high-end machinery data processing tools to achieve that, and the processes to do that on a very cost-effective, almost on a chip basis, is one of the things that they pioneered and continues on today, to where we can now start to envision that you could have your entire personal genome mapped for under a few $1,000s, which before would have cost tens to hundreds of thousands of dollars. And the long-term effect of that, of course, is that then we could take and individualize your treatment protocols for you specifically, especially in areas such as cancer treatment. There's a lot of work in breast and prostate cancer in particular, where you can now diagnose what the specific genome of the cancer is and attack that on an individualized basis, just as some small examples of that.
Now this, in IT Optimizers, who is your typical client who's coming to you?
So our typical client is a large 2, 3, 4 hospital-based health system, which would also have some health plan operations, large physician practices associated with it. So someone who is trying to achieve or has already achieved what we would call a healthcare delivery system, where they've been able to focus hospital, physician, continuing care and payment together in some way, not quite at the Kaiser level. Kaiser tends to be the embodiment of both their market, if you believe the advertisement, to be care and financing together, but organizations who are trying to get there to basically manage a population of their residents around them. So we have many of those in the Bay Area as well as across the country who are doing, but that's our primary. Then we also serve the health plan industry. So roughly a third of our clients would be health plans or a delegated risk physician group. So that's a physician's group of scale who has, for an economic price, $1 per member per month, taken on responsibility to manage the care of their patients, both on the outpatient basis as well as on the inpatient basis. A good example of that would be, for example, Hill Physicians Medical Group.
You know, the Affordable Health Care Act must have had some impact on what you do.
We have. It's created at first a great land grab for physicians and for provider networks. It has also created, in interesting ways, very unintended positive and negative consequences. So some of the positive consequences are there's been a tremendous reshift to what is healthcare really about. So historically it's been about fixing that broken leg, making sure that you're reasonably healthy, but really about correcting illness or trying to remediate an illness. So the Affordable Care Act, with an emphasis on population medicine, has really started to focus on how do we create health. And it's a long-term discussion. It doesn't happen overnight, but it's been a very good conversation to have. It's somewhat always been in the healthcare system, but we've never had a mandate to really look at it. The other real positive side of the Affordable Care Act, of course, has been new industries building up, in particular around consumer-based care, virtual-based care models. And those are in part driven because through the Affordable Care Act, we're getting more insured patients in. We don't have the physician or caregiver workforce to really meet that demand. Plus, there is a growing cap on the amount of reimbursement that we're going to have in our system. So we have to look at alternative means to providing care. By saying alternative, that doesn't necessarily mean worse. I think some of the models are showing that the alternative care models are equal to or better than the traditional medicine side. And then, of course, there's some bad sides to it. We just got our premium increases. We had, in our company, we had to go to an ACA compliant plan, and costs are going up, and some insurers are starting to look at leaving the market for the ACA compliant plans, if you will, or for providing the individual coverage because of the costs associated with it.
I know a lot of people are in this the renewal period and experiencing the bump in premium. So I'm visiting here today with Joe DeLuca. He is the founder of IT Optimizers. Joe, I need to take a quick break. We'll be right back after these messages. Since you can't take your wealth with you, spend time with your family. Welcome back. I'm here today with Joe DeLuca. He is the founder of IT Optimizers, and we've been talking about transformation of the healthcare industry. And one of the things I've noticed is that there's somewhat of a disconnect. It seems that the industry is trying to move over more to wellness rather than treating symptoms and disconnects. And where do you see this right now?
So that is absolutely one of the directions, and for lack of a better word, both the policy mandate and, quite frankly, what most people want is to maintain your health rather than having to deal with illness. We, as an industry, if you will, and as a country, we've always had a focus on wellness and health, but we've not had an economic model to support that. So even today, in large parts of our healthcare system, a physician is paid on a fee-for-service basis because you have an office visit or you go in for a procedure, rather than on maintaining your health, where then they receive a certain amount of dollars per month to do all of the services for you over a long period of time, so that they can give you more expensive tests up front, but it might prevent or do an early diagnosis of a problem. So part of, for example, we were talking earlier about the Affordable Care Act. Some of the good parts about that are mandating immunizations as part of routine coverage, mandating certain levels of required diagnostic tests up front, which are proven to have long-term benefits by reducing either catching things early or preventing illnesses. But we still are working in a mixed system. So the concept of health and wellness is inconsistent with large parts of the economic model, even though we think it's the good thing to do from a humanistic and moral perspective. But we're getting there. There's some good changes that are coming about, but it'll take time.
Now, Informatics is a software-based company?
So informatics is sort of a broad term that we use to relate to the management and interpretation of data in the healthcare system, and informatics doesn't necessarily have to be related to healthcare per se, but we really use it to basically reflect the collection and transformation of data into meaningful information, sort of like the science of how we do that. And it could be as simple as how do we do better predictive diagnoses of someone who's having a heart attack, Or it could be, how do we find out a better way, use these large databases to find a better way to treat and manage diabetics. Or it could be, in the case of community-based medicine, how do we find the people in the community who are calling 911, using 911 inappropriately from a system perspective, and intervene with them. Our EMS system is great as identifying who are the patients who run out of money at certain points of the month, so they don't take the required food with their potential medications. They then have some form of an adverse drug reaction, and their response is, especially in the elderly population, to call 911. So informatics would help to identify those hotspots of need, and then to get community-based social services involved, as an example, to help that. So it's a very broad use of the term, but it's really about data analytics, transforming that into information for a positive outcome. I talked about these are some clinical examples, but there are also others that would relate to reducing cost, reducing variation in care, getting clinicians to work at a different level in the system. So having a nurse, for example, do things that a physician might otherwise do, so it's within the scope of their license, but help to extend the range of their productivity. And we can prove that using data that, for example, having the nurse involved or having the nurse do it doesn't affect the quality of care, might even improve the quality of care versus a physician doing it.
I'm visiting here today with Joe DeLuca. He is the founder of IT Optimizers, and we've been talking about the future of healthcare. Joe, I need to take a quick break,
No problem.
And we'll be right back after these messages.
I love fishing, with my family.
I think it would be easier to use a net.
It was so much fun.
The times when we are together, it makes it all the more worth it.
Having Dad teach them how to cast a fly rod, and
as long as we're doing stuff together, we're having fun.
Some people see a father and his son fishing together, while others see a succession plan. Welcome back. I'm visiting here today with Joe DeLuca, and we've been talking about the programs that you have running at IT Optimizers, which is focusing on, I'm going to just call it big data analytics for the healthcare industry. But it's, what fascinates me is from a consumer standpoint. We look at the Affordable Care Act and what that did to private insurance premiums and overall, but you're working on an entirely different platform of trying to revolutionize and change an industry that has been based on reactive medicine to preventive medicine. Now, how do you incentivize companies and healthcare organizations to go along with this change?
That's sort of the $64,000 question about how you do it and actually achieve it. And I think there's different groups that have to be incentivized and motivated. There's of course the traditional healthcare provider system, hospitals, doctors, and largely they're going to get incentivized by seeing at least equal economic neutrality to where they're at in a fee-for-service market, to sort of polarize the question between fee-for-service and health and wellness being in a different economic model than that. So they have to see that they will at least be no worse off by doing this economically, and potentially better off. So the Affordable Care Act and other programs that were in place before ACA came in, primarily in Medicare and the state of California, Medi-Cal, were focused on providing value-based payment incentives. So we will pay you what you were getting before, and if you deliver better quality, you reduce admissions to hospitals for cases that you've already had there. So basically you treat them right the first time. We'll give you more money for doing this. So that helps to raise the economic bubble and provide some motivation that way. But really what's happening from a motivational perspective depends on the age cohort of individuals. So when we look at younger persons, millennials in particular, they're completely motivated differently relative to health and the use of the healthcare system. So a lot of their economic motivation will basically come from alternative therapies, viewing the healthcare system as the place of last resort. I go to the hospital or the doctor when I'm really, really sick. I go to my alternative panels and of medical providers, possibly those that are actually within my employer environment. Google, Apple, others have been very good at setting up alternative therapy clinics within their employed environment. And their motivation is really to reduce costs for them. They don't want to expend the money that we're having to pay in our age cohorts. So at the end of the day, it's really going to still come down to the money side, and how we at least on one side keep neutral and provide some room for growth, and on the other side keep healthcare costs low, because at the millennium and mid-career level, that's disposable income that's going out. The more I have to pay for healthcare, the more less money I have for other lifestyle needs, building a family, so forth.
In the news recently, you saw companies like Theranos, who is all about wellness. So Walgreens pulled the plug and said, okay, we're going to kind of limit. How does that affect the industry as a whole, and what's your take on that?
So that's a good one. And there's a lot of different dimensions of, because when you look at that company's primary disruptive strategy, which is to take this Goliath lab testing industry and break it down to miniaturization that can be done at point of care. If they are effective at doing that, that's not only a consumer-based approach, but you take that same technology and put it into the hospital setting and allow at the bedside the complexity of testing, of blood-based testing that you would otherwise have to ship that blood off, run a centralized lab to do, huge disruption to the system and a potential huge reduction in cost. So very noble effort, very, very important area to work on. On the other hand, though, the company has really been cloaked in secrecy, and in the healthcare industry, we don't like the lack of transparency. So that creates suspicions about what is behind the product or not behind the product, and also creates a sort of an attitude of, well, if they're doing this now, what are they going to do in the future? What's the real motive behind this? So we've been fighting it, with whether it's medical device companies, pharmaceutical companies, big medicine, the payers, the healthcare insurance companies sort of fight through the same item. We're now looking at very, very strong quality transparency measures. So when we go back to the informatics side, a lot of what we end up having to do is public-based quality reporting. So you can now go out to public websites and you can compare your doctor, your hospital against different quality measures, against life statistics. If I go there with a heart attack, not only what is my likelihood of surviving there, but what will my quality of life be like afterwards. So we're moving more and more towards broader-based transparency, and at least in particular, that company embodied less of that at a time when we're seeking more of that.
I'm going to kind of change the direction of this,
sir.
but I want to talk about IT Optimized. One of the things that you do is you help companies with strategic planning and also building effective teams to manage change.
Correct.
How do you build the effective team within these large organizations?
So it's a very multifaceted question. So to build the teams, we first have to identify what the performance excellence goal is that we're trying to achieve within the organization, and then take a look at, do we have leadership within the organization that we can take and transform, or do we, in our transformation effort, basically have to recognize we need a new generation of leadership around that. And then we tend to put a lot of fancy words around it, but it's really pretty simple human management and professional development dynamics that you come in, find out what the goal is, develop the goals, put together usually a multi-year plan about how we're going to get there, and then start working for small kernels of success that start to build the management competencies and the confidence in what they're doing. It's all about confidence, just like a sports team. You have the best talent, but you've got to build them up. So we find those kernels and then just start building it up. You'll inevitably have a couple setbacks. Those are actually good, because you can then use that as a way of refocusing the team and getting them up to a level of performance excellence that then embodies their confidence to move forward. Sadly, at times it means that you have to recognize you have the wrong people on the bus. You have to get some new people on the bus. So when that occurs, it's helpful that you can move people around in a very professional way. Or the ones I love are when it's de novo, which is brand new functions we're standing up, in which case we can really grow a new team. We had one of the highest compliments paid to us recently at a client site where they said, you built this function, and while you thought you were just standing up this particular business unit for us, this analytics unit, it really raised the bar of performance across the organization, because everyone started looking at what you were doing, and then all of our clinical management teams, our financial management teams said, we need to be more like that. So we became a team to emulate in the process. It's quite a compliment. Really enjoyed that one.
So a person that's interested in engaging IT optimizers, how would they go about contacting you?
Hit a website and give me a call, or hit my email on the website.
itoptimizers.com?
itoptimizers.com, based in Oakland, California.
Joe, we appreciate you having on today's show.
Thank you. It's a good time to. So how many years have we worked together, known each other?
We've been together for over 25 years.
Yeah,
and so it's been a good run.
Yeah.
So been visiting here today with Joe DeLuca. He is the founder of IT Optimizers. For information on engaging Joe, go to itoptimizers.com. We'll be right back after these messages. Since you can't take your wealth with you, spend time with your family. Welcome back. I'm here today with Joe DeLuca. And Joe, during the break, we were talking about what transformed you into this IT Optimizers, the case study. Can you share that with us?
I'll be happy to. And it goes to one of the questions we often face is, in order to do some form of significant transformative change, do we have to have big data to do it? Or can we use little data that has little data sets, little analyses that have big implications, big results for the system? So early on in my career, back in the late 70s, which will date me, we'll go over that, I was on a research project where we helped to build mathematical models to predict the probability of surviving a heart attack or a trauma event or a burn event when you were in the field. And we used this to go in at the time and justify helicopter transport for what we now know for the golden hour, and to go into hospitals who at the time who didn't have 24/7 emergency department physicians there, and allowed them to allow the nurses who were on staff to do something as simple as open up an airway, which is really a mechanical skill. Doesn't require a physician to be on site for that. And we were successful in doing that, and it immediately shot up the survival rates in the areas, in the geographic areas that we're looking at. So a very small data set that had a very significant implication. But it did something else. It opened up in those communities the medical professions sort of eyes to, well, if we could do this in this one area, we can allow a nurse to open up an airway on someone. Maybe there's other things we should be looking at that are within their license and would expand the service. So it basically then started a change process of rethinking what are the skill levels that are required to do certain types of procedures. And that is another sort of consequence that came out of it, to where then different levels of care, different levels of practice were considered that wouldn't otherwise have been considered. So small piece of data leading to a big immediate positive outcome, and then setting a cultural basis for moving further.
I know in the airports today, when you walk through, you'll see a lot of these defibrillators that are just set up.
That's another actually good example of that. There's small data sets that said if we put those out there, we can save more lives.
Yeah, unfortunately, I had a friend about a year ago that was on a boat and in the Bay. I wish there was one of the machines there because he had he died, and the autopsy said his heart just stopped beating, and the defibrillator would have saved him. So
sadly for us men, like 50% of the first sign of a heart attack and 50% of the cases is death. So it's a morbid way to end
So
this.
we'll see more of this. What we'll see is more of this into the future in terms of the procedures don't need to be limited to the doctors, but there'll be certain things that we can be engaged in to help.
We're already seeing that, and it's not only through direct provision by medical professionals, but also virtual care teams. There are new companies and new models of care where telemedicine, it's often referred to telehealth, where you can get second opinions or have a physician remotely take a look at what your conditions might be. But a lot of expansion in this area.
This DNA, one of the things that you do is DNA analytics, or making that available.
Well, we help to build the databases that would help that, right? Correct.
And how convenient will that be for us to acquire in the future?
It's actually fairly convenient to acquire it today. So you can go through DNA testing services and get your profile, basically either a very narrow or very broad profile developed, and get you information both about your potential disease profile, also get you ancestry information, because that's in large part what it's based off of. And then those are readily accessible through secure web technology that you can then share with your provider or physician or not. One of the problems we have, two of the problems. One is much of the medical community doesn't know how to interpret that information. So we have it, but what do I do that's actionable relative to the care of Alan or Joe that's associated with it? In the specialty cases such as cancer, those have developed into very specific subspecialties where at the academic medical center, Stanford, UCSF, others, you have the talent to be able to then say, well, here's what I'll do differently with this information that's there. So that's one problem. The second problem is our computer systems, our electronic health records haven't quite caught up with this yet. So we can get a text-based report, like a lab report, that says what's there, but we really can't get access to the direct DNA files. Some organizations, St. Jude's Children's Research Center in Memphis, Tennessee, they do quite a bit of scientific analysis at the bedside, so they do have capabilities that allow then the physician and the care team and the scientist, the medical scientist, to look and say, based off of this particular genome and this specific configuration, I can do something different for the patient at the bedside. So, but we're getting there, but you can do this now and publish it. You can publish your genome.
I've been visiting here today with Joe DeLuca. Joe, we're out of time today, but for more information on contacting Joe and engaging IT Optimizers, you can go to the website itoptimizers.com and look for Joe DeLuca. Joe, it's been a pleasure being with you today.
Pleasure to talk. Thank you.
Thanks for joining us here in America Dreams, and join us next week right here on this station.